Well, this workshop is looking at the neglected tropical disease. The World Health Organization has identified that we should try to get rid of them. So the group that we're having now, with the assistance of the World Health Organization, they're here. We've made a lot of progress in the past, but now we want to look at how we can eliminate a lot of these diseases. There are only about 7 that have been in Fiji. Put together a plan so we can get rid of a lot of these programs, a lot of these diseases that we've had in the past. That's basically what we're here for. The key message for me to the participants is I believe that they already have the expertise to do it. We need to put together a plan and the importance for us to get everybody involved. If you want to do something in terms of health, you can't just do it in the Ministry of Health. You have to bring in other government agencies, other stakeholders. So it's important that once we have developed a plan, that everybody that is part of this group needs to go out there and make that plan work. And that's the most important. That's why we've talked about the importance of leadership across all of the ministry to make sure that we can get rid of these neglected tropical diseases. Well, some of these diseases have been around for a long time. Things like, all the ones that we have, the scabies and all of these problems. We've really reduced them, but they're still there, lingering on. A lot of these diseases are to do with sanitation, cleanliness, and things like that. It's just making sure people wash. Things like trachoma and other things like that. So really, if you want to address these things, you have to address things like health and sanitation. That's why we need to bring in other government departments, Ministry of Works, people responsible for housing, all of those things. We need to bring that in, address all that in order to get rid of these diseases. These are diseases that have been around for a long time. We've managed to control it over the past few years, but now we want to eliminate it altogether. It's usually for treatment. There's always things like number of doctors and things like that. But I think the important thing for all of us is to look at how we can prevent things from happening. And the technical experts are here. They'll be able to explain in much better detail. But we can see that a lot of these diseases come out of things like poverty and sanitation. So if we can address those things, we've gone a long way to addressing these neglected tropical diseases.
So do you think this is very timely?
It is always timely. Anything to do with health is timely, because at the end of the day, all you want to do is a healthier Fiji. And if there's, though a big problem that we have for is people dying early from NTDs, but still we have these other complications around. And it's always the government's intent is to make sure that people have a better life. And to do that, we need to get rid of the diseases that we can get rid of.
So any message to the general public?
I think for the general public, once the plan comes into place, we will be having awareness messages, and we will be inviting everybody to participate in the activities that allow us to eliminate these neglected tropical diseases.